Hi there, welcome to another episode of Your Health, Your Life. This is Dr. Kajimoto, hosting this show today. Today I want to talk about heart failure. I'm sure most people could be familiar with the phrase because I think we hear it a lot. Wajabali na heart failure. Somebody has heart failure, translated. So what is heart failure? Well, I think we've mentioned before that the heart's main job is to pump blood out of the chambers to take it everywhere else, all right? All the other organs. So if the heart is not really able to do that, then all the other organs would also suffer. So basically when we say heart failure, in simple terms, it's a pump failure because the heart is essentially a pump that pumps out blood. So if your heart is not able to pump out blood, we call it heart failure. That can happen due to a number of things, all right? A number of things. But in this discussion, we're going to limit our explanation to your heart muscles becoming weaker and weaker and weaker, resulting to a point where your heart is eventually unable to pump out enough blood to go to the rest of your body. But suffice to say, there are many other causes of heart failure that maybe we may talk about in the near future. So what symptoms would somebody with heart failure present with? Well, most patients are going to present with symptoms of difficulties in breathing. Most patients are going to present with easy fatigability, and by that we mean that the patient gets tired easily, all right? They take a few steps, they get tired. Some patients try to comb their hair, they get tired. Some patients try to do their own patterns, they get tired, all right? Then some people may also just notice that they're not quite able to do as much as they used to. That can actually be one of the earliest features that you could have, that your heart is failing, all right? Other things that other patients can also present with include things like palpitations, all right? They can present with a cough, and the cough can actually be productive, all right? By productive, we mean that when they cough, they're able to produce sputum, and usually the sputum has a tinge of blood or looks pinkish in nature. And then most patients with heart failure at the end of the line usually also present with swelling of the legs. So usually those are the symptoms that would be suggestive of heart failure. Now, I know most of the people that watch this show are also medical people, so we're going to distinguish the symptoms I've mentioned as being highly suggestive of left-sided heart failure. That's without the swelling of the legs. Yeah, but then of course, we can get into the technicalities later. But generally, what I've mentioned is basically suggestive of heart failure, all right? What things can predispose someone to getting heart failure? In our setup, the commonest risk factor is hypertension. When we say risk, we simply mean something that predisposes you to getting the disease. So hypertension, diabetes give you a high risk of having heart failure. Hence, the need to make sure that we control those risk factors of hypertension and diabetes. How do you diagnose it? In the hospital, the doctor would do a couple of other tests. They can do imaging. They can also do some blood tests, all right? When we say imaging, we just mean things like x-rays, CT scans, and the like. They can also do electrical studies of the heart that we call an ECG and an echo that will give us an idea of how your heart is basically working. But what I wanted to focus on in today's presentation, in today's talk on heart failure, is on the treatment of heart failure. And not the technical aspects of the treatment, but the actual principles that underlie the treatment. So when your doctor gives you your heart failure drugs, I think there are two main goals to that. The doctor wants to improve your quality of life, all right? Then the doctor also wants to prolong your life, all right? Essentially, that's it. So there are certain drugs that will prolong your life, and then there are certain drugs that will improve the quality of life. And sometimes the drugs that are used to improve your quality of life may not necessarily prolong your life. Then other things that the doctor is also going to reduce is your possibility of being readmitted in your hospital, all right? Because that's also something we want to really stop. So when your doctor gives you those drugs, you really have to understand, okay, fine, what do I have in my hands? So on one hand, you have drugs that will improve the quality of your life, and you have drugs that will prolong your life. And you have to figure out exactly how you're going to get the benefit from those drugs. So from most of the studies that have been done, the drugs that prolong your life have to be taken consistently over a long period of time at specific doses. So if you don't reach those doses, you may not actually get the benefit of having your life prolonged. So that is why when you're being treated for heart failure and you're on specific drugs that your doctor would recommend, you may find that your doctor will keep increasing your doses to reach specific doses, even though you feel much better. And that is the rationale, because most of these drugs have been found to prolong your life at specific doses that both you and your doctor have to discuss together and set up specific targets of your treatment, okay? So remember, quality of life drugs, prolonging your life. The drugs that will prolong your life needs to be taken consistently at specific doses over a long period of time, as opposed to starting and stopping, which is what most people do in our setup. So some patients are started on drugs for heart failure, they get better or they feel better, and then they stop taking their drugs, and then a year later, they're worse than they were before, all right? So we don't want that, because it's only when you take your drugs consistently that you may actually get a longevity in your life. So remember, heart failure is common among us. It's amongst the most diseases that we have as Zambians actually in the hospital. And there's a lot of people out there with heart failure. So if I'm speaking to somebody right now with heart failure, do not stop taking your drugs, all right? Take them consistently and follow your doctor's advice. From Your Health, Your Life, have a lovely day.